One of the most common things I hear in consultations is, I don't want a facelift because I don't want to look stretched, frozen, or like someone else. Let's talk about that, because modern facelift surgery is nothing like the outdated stereotypes patients still fear. If you've been hesitant about facelifts, I understand why. Movies, tabloids, and old surgery techniques created a belief that facelifts make people look tight, unnatural, or overdone. But as a facial plastic surgeon who focuses exclusively on the face and neck, and someone trained to make precise decisions under military standards, I want to separate myths from medical reality so you can approach this with clarity, not fear. Myth number one, a facelift makes you look like a different person. A proper facelift restores your own facial structure. If someone looks unrecognizable, that's not the fault of the facelift. It's the fault of a surgeon ignoring a natural anatomy and balance. When I evaluate a facelift candidate, I studied the patient's individual bone structure, tissue descent, and the way their face aged. The goal is not to chase youth, it's to restore harmony in the features they already have. Patients often tell me, I feel like myself again, not I look like someone new. And that's the intended outcome. Myth number two, facelifts pull the skin tight. Modern facelifts lift from underneath the skin. The original techniques focus on stretching the skin, and often in an incorrect or wrong vector, which did create tight or windswept looks. Today, we lift and support the deeper structure, specifically the SMOS layer, which is a natural anatomical foundation of the face. By elevating the muscle and the connective tissue, the skin follows naturally and looks soft, not stretched. Think of it like adjusting a frame, not pulling wallpaper. Myth number three, fillers, threads, and lasers can replace a facelift. They can help, but they cannot reverse structural aging. Botox helps movement lines. Fillers restore small amounts of volume, and lasers resurface the skin. Threads attempt to pull structures with dissolvable sutures, but these often fail. In recent years, we've seen the introduction of many energy-based devices such as Morpheus, FaceTite, Ultherapy, etc. that aim to lift tissue without surgery. These sound fantastic, but the reality is that they have a high failure rate. None of them can reposition descended tissue or restore jawline and neck definition once those deeper layers shift, and that's where surgery is still the gold standard. I remind patients that the best outcome results from combination therapy, not one strategy that trumps all other treatments. Fillers, lasers, energy-based devices are minimally invasive procedures, but minimally invasive procedures are little procedures, which give little results. In order to get noticeable, excellent results, you need more aggressive intervention, and surgery is by far the most aggressive technique, meaning a facelift will achieve the most dramatic and natural result. Myth number four, people will know I had work done. When done well, people notice improvement, not surgery. This is where facial judgment matters more than technique. A facelift should enhance the soft angles of the jawline, neck, and mid-face without exaggerating any feature. Patients often report that their friends tell them, wow, you look really good. Did you go on a vacation? Did you lose weight? New haircut? Not, did you have surgery? And that is the goal. You want to look refreshed, not altered. Myth number five, facelifts are only for people in their 60s. Many ideal candidates are in their 40s and 50s. Aging doesn't begin at 60. It begins steadily in our 30s and 40s. And when performed earlier, a facelift can have subtle, lasting, and incredibly natural results. It's not about age, it's about anatomy, tissue change, and your personal goals. If you've had concerns about facelifts, I hope this helped clear some of the myths that hold patients back. Facelifts today are safer, more natural, and far more sophisticated than most people think, especially when technique and judgment go hand in hand. If you like clarity on whether surgery or non-surgical options would be best for your goals, feel free to reach out or leave questions in the comments. I'm here to guide, educate, and help you make the most informed decision for your face, not sell you on procedures you don't need.